Well, I think if we're all on, we can start.
Why don't you wait till exactly 2:30, which is in a minute.
Yeah, we are early.
Everybody's early. That's great.
Wait, not in South Florida. Are you crazy? We should start about 3 o'clock.
I'm not saying anything.
Yeah, you know I'm right.
I'm not
I'm right, Dan. I can't speak for the rest of the state, but I can talk about us.
We're in Miami Beach time, so we're early.
Yeah. Yeah, right.
All right, I got the green light to start, Mayor Gelber. So good afternoon to everyone. Thank you so much for joining us, to all the elected officials, to all the media, members of my colleagues of the media. Thank you, because we know it's a very, very busy day. So we're going to get through this as quickly as possible. We know that COVID cases continue to rise in the state of Florida. So we're all alert. And we just want to make sure that we get the word out to our residents, to our community, to our state. So thank you so much. My name is Veronica Pacey. I represent the Office of the Mayor and Commission of the City of Miami Beach. My email, by the way, if you need to email me, is just very simple, vp@miamibeachfl.gov. And you can also, of course, communicate with me via the chat. To the members of the media, we will be taking questions at the end. We will let Mayor Gelber introduce himself, even though everybody already knows him well, and he will introduce the other mayors, and then we will open it up to questions. As you well know, our Zoom rules, you will raise your hand and we will unmute you, and then we will go from there. Most of the members of the media have requested to record the meeting, and we have allowed them to do so. We are also recording the meeting for our purposes. So let's begin. Mayor Gelber, you have the Zoom floor.
Thank you. Thanks, Veronica. And, I want to thank my colleagues from around the state, not just Miami Shores Mayor Crystal Wagar and Mayor of Hialeah, Carlos Hernandez, but my friend, Mayor Rick Kriseman from St. Petersburg, and from Broward County, Sunrise Mayor Mike Ryan. The truth of the matter is that, we talk about the pandemic pretty regularly. We share the challenges that we're confronting. We talk about, what we think should be done and what shouldn't be done, and what's working and what isn't working. And so the reason why we are having this today is that, as we've talked about this, I think it has become pretty clear that what Florida is doing right now isn't working. It's unmistakably clear that Florida's approach to managing this pandemic is failing pretty horribly. Vaccine is on the horizon, but the truth of the matter is Florida cases are approaching 900,000. Yesterday alone, there were 85 deaths, adding already to the nearly 18,000 Floridians who have perished. This morning in my community, and I know probably, I was talking to Mayor Ryan about this the other day, in his community as well, blocks, people lining up for tests are around the block. New cases, hospitalizations are surging to levels we haven't seen since August. So, rather than just talk amongst ourselves and to our commissions and to our managers and to our residents, we thought maybe we should try to reach out in this way with each other to sort of try to give the governor some direction from our perspective that we think is pretty important. So what we're going to talk about today, and the mayors, some of which I think we agree about some things, but they may have some things that are particular to their communities that they want to emphasize and stress. But there are clearly a few things that we need to do. And I think the one thing that I would say from my perspective, and some of this is just my perspective, but the herd immunity that is being advanced by some of the advisors of the governor really isn't working. It's not protecting the vulnerable. We've seen that already. In my community, a small community, had 13 seniors who died in a nursing home. Positive cases are rising steeply, and it's spreading everywhere. So we don't believe that this is going to change unless we do something different. There's no reason to believe that these, devastating trend lines are going to recede unless we change what we're doing. So here, there are 4 subtopics, but within them are a lot of different ideas. but that I'm going to recommend, and I think my colleagues will probably agree in part or in whole. First thing is, governor needs to implement a statewide mask mandate. It just is needed. Across the country, governors of every political stripe are doing it. They realize that it is clearly, at this point, one of the few things you can do that allows you to open up the economy in a ways that protects the public and reduces the spread. And we just need to have it. Second thing is we're asking the governor to allow local government to enact kinds of remedial measures addressing local conditions, including enhanced mask enforcement. As my city had done, we had issued 1,000 mask citations before the governor prevented us from doing any more. Capacity limits, social distancing requirements, and also to give local governments freedoms. And I know Mayor Hernandez is going to talk about this, to deal with their budgets in ways that are particular to this crisis. And also to have its meetings the way they want to, because I'm in a meeting now, but if we invite the public into a meeting, we encourage a situation that we probably shouldn't be, a very unhealthy situation. Third thing is to restore state testing facilities and operations to their fullest capacity. Right now, people want to get tested, and they don't want to get tested for no reason. They want to get tested because they believe they need to get tested. That's usually why people go get tested, because they think someone they knew or were around has the virus, and they want to go get tested. Right now, they got to wait around the block in my community, and I'm sure it's like that throughout the state. And the state has rolled back its testing facilities. We allowed the counties to fill in some of the gaps, but that's not going to last forever. The state needs to take control of this and has to provide full and available testing for everybody. And the last area has to do with contact tracing. We believe that contact tracing has to occur right now in a better way. Right now, DOH is not following best practices. In my community, for instance, in the week ending on November 13th, amazingly, the contact tracers were only able to interview a little over 40% of those people who were infected, which means close to 60% of the people who were interviewed were not even interviewed and never gave any information about who they had been in contact with, or about quarantining or anything like that. And the other thing we think they should do is, Florida has not adopted any significant app to help in the contact tracing. There's been no online app that Florida has truly adopted. Now, Google and Apple have an enterprise app that is being used, but it cannot be used in a state unless the Department of Health allows it to be used. And in Florida right now, it's not allowed, which means that Florida, and in fact, local governments, don't have the ability to use that app. So we would also ask for the governor to have the Department of Health who reports to him to please allow local governments to, in fact, utilize the Google Apple enterprise app, because in states where it's being used right now, it is proving to be effective, and it's something that is being denied the residents of our state. Since the governor opened up the economy totally in late September and simultaneously prevented local governments from enforcing individual mask mandates, we have seen an enormous surge. There's just no question about that. And because of the nature of indicators, because they're lagging, all these increases in positive are surely going to be followed by hospitalizations within a few weeks. So the increase in hospitalizations we're seeing right now, and in my city, we've had, in my county, we've had over 60 or 70 in the last week, which we haven't had since August. That's going to be that followed the increases from a few weeks ago. Well, the increases we just have seen, and we had over 2,000 on a single day in Dade County, is going to be followed in 2 weeks by even more hospitalizations. So you can't wait for this crisis to hit you in the head over and over again, like a brick. You've got to act beforehand, and we've already missed so many of those opportunities. A vaccine is on the horizon, but this pandemic isn't going to be in a rearview mirror for likely at least 4 or 5 or even 6 more months. And while I fully share the goal of reopening our economy and avoiding debilitating lockdowns, and I know the governor shares our view about the health of our residents, this approach is neither saving lives or livelihoods. Our state's primary economic engine is hospitality, and people will not travel here if they believe it is unsafe. In fact, I'm convinced that projecting our state as a place where people are not wearing masks and where the virus is allowed to spread unconstrained will only serve to discourage visitors. I've seen responsible people in my community, responsible entrepreneurs, really do a great job. Hoteliers, restaurateurs, and business people adopting terrific health and safety standards that foster customer confidence. That's what we want. Our way out of this is to enact those measures, and we're asking the governor to change his direction now, because the direction we're going in is, unfortunately, it's killing people, and we can't continue the way we're going. So with that, I'm going to ask my colleague, St. Pete Mayor Rick Kriseman, to say a few words, and then we'll go down the road. You got to unmute yourself, Mayor Kriseman. Veronica, or you got to unmute Mayor Kriseman. I want to hear what he has to say.
There you go, Rick.
There we go. Thank you. Thank you, Dan, for putting this together, and for each of my colleagues that are on this Zoom with me. Thank you. You know, as mayors, we all know what we need to do to try and protect the residents of our communities, and it's just incredibly unfortunate that the positions that the governor has taken thus far have made our jobs very difficult. You know, I look back prior to the governor entering the Phase 3 order, and in my city and in our county, we were on a rolling 2-week average between 2.5% and 3.5%, and we were steady at that percentage. Then after his order was entered, and his order, like so many of the orders that he's drafted, created incredible confusion in our community, not just with the business community, but with governments in our county, trying to understand what he was doing and what he wasn't doing. Within 2 weeks, we've seen our numbers substantially go up. And as Dan was mentioning, you know, look, we understand the economic impact that potentially some of these orders could have. But we're also trying to look at this from a long-term basis as opposed to short-term. And if we don't deal with this now, the economic catastrophe that we are facing will be far worse if we have to go to a complete shutdown. Simply allowing us to put the processes and the measures in place to help us get our numbers back to where we were before. Having a mandatory mask mandate throughout the state so there's consistency. Allowing us as individual counties and cities to determine what other restrictions make sense, whether it's a 25% occupancy limitation, a 50%, whatever that number is that works for our communities, allowing us to do that and allowing us to enforce that can help us avoid the economic catastrophe that will happen if we don't get these numbers in place and have to go to a complete shutdown. And Dan mentioned herd immunity. Some of the healthcare experts have indicated that if we continue to follow that track, that this is the solution. There's roughly 50,000 Floridians who will die that don't need to die. Now, to me, everyone in my community, one death is too many deaths. And I find it hard to understand how the governor doesn't seem to be very troubled with the concept that there could be 50,000 deaths that take place that don't need to because we are following herd immunity. And you have to question the people he's listening to and he's getting his information from. I know all of us as mayors, we have access to some of the brightest medical experts in the country through the U.S. Conference of Mayors, through Bloomberg Harvard, and in our own communities. But yet this governor seems to be listening to Dr. Scott Atlas, who's a radiologist. This is not an epidemiologist. This is not an infectious disease specialist. He is a neuroradiologist. And his practice and his study has been on neuroradiology. And then the other person that apparently now is going to start giving us the data that we're supposed to rely upon is a former sports blogger and Uber driver from Ohio. You can't make this stuff up. And so we've got to have a state that follows the same rules and puts in place the same rules as so many other states around the country. And as Dan also said, this is not a partisan issue. This is not Republican, Democrat, red, blue, because look at Ohio, look at Governor DeWine is doing. There are 10 states in it right now that I can think of off the top of my head who have Republican governors, all of whom have had mandatory mask orders. And so you know, all it says to me is that for whatever reason, our governor has decided he is going to follow the lead of our president. And he's not going to listen to what the medical experts and the healthcare experts are saying. The four topics that Dan outlined, we are in complete agreement with. Having a statewide mask order, having the ability and the flexibility for us as local governments, whether we're city, county, or school board for that matter, to be able to make those decisions that best fit our communities is critical. We had 1,100 people tested yesterday out at our Tropicana field site testing that the county has put in place with state assistance. But in speaking with the county, they are afraid because the state has indicated they're pulling staffing. And so we're all going to be scrambling to see if we can staff these testing centers. So we're talking about decreasing testing at a time when we should be increasing testing. And lastly, having a robust contact tracing is really critical. All we're asking for as mayors is for the support of an administration in Tallahassee that is looking out for the residents of the state of Florida as much as we are for the residents of our community. So, thank you.
Veronica, can you unmute Mayor Carlos Hernandez?
He's unmuted.
Thank you, Veronica. Mayor, it's just great to be here with everybody. I'm not going to repeat those 4 points that I think make total common sense. As everybody knows here, the city of Hialeah was the city, or is the city most affected with coronavirus. You know, blue collar working city, huge numbers, and we went through hell on the first phase. And to me, makes no sense whatsoever. And I've been very critical of the governor and the way he's handled this with my city, with South Florida. And I think it's always been a lack of communications between the state and local government. Listen, here, even in South Florida, you know, Dance City, Miami Beach, we're next pretty close, but we're different. And I don't know, Dan knows more about Miami Beach than I can ever know. And I know more about Hialeah and the things that are happening because we're on the streets. We're talking to our people. So it makes no sense whatsoever that instead of working united, there has been no communications. And I agree that to us, when the governor took our power to enforce, to be able to use citations we were using in Hialeah and to go into business and make sure they were doing what they're supposed to be doing, I think that's been a big issue in our community when he took the teeth out. And I hope that he can revisit these things and understand that we're here to work with them, not against them. And we want what's best for our citizens, which is our citizens, the state of Florida. Again, for me in my city, like I said, a blue collar city, the mask, social distancing is what's going to keep my businesses open. I am so fearful, and I hope I'm wrong and he's right. But the way things are looking and what the scientists are saying, we're going to find ourselves in a position where, my God, I don't want to imagine having to ask business to close again. And I think we still have time. But as long as we can work together, he'll listen to us at the local level and give us some flexibility. And at the same time, again, I agree, it is about time that we mandate masks statewide. It should not be a joke. It's not something that we should decide one way or another. We're getting to that point where every day, more and more cases. Yes, we haven't gotten to the critical stage we got a few months back, but we're going to get there. So it is important that he gets his message. I mean, again, I've had my issues with him, no secret. I've been very critical, but I'm here waiting to open up and say, let's talk, Governor. We have ideas. We want to work together. This is not about Republicans or Democrats. I'm a Republican, right? And I'm the most conservative guy in the world. But we have to take care of our health and our business. And the best way to do that is by using that balance that right now it's like, hey, it's just going to go this way and hopefully it'll work out. Also, there's a fifth point that I want to bring up, and I know I brought it up today with the Florida League of Cities. The cost of the cities have been incredible with with the coronavirus. Now, this coronavirus assistance money we got, no, that doesn't cover the shortfalls of all the cities, because we were expecting revenues from the state that never came and are not going to come next year. So one of the things that I know that the Fralica cities have asked the governor for him to go ahead and make an order or go through legislation. But for us cities to be able to use restricted funds that we have in other accounts, and bring them towards the general revenues where we pay for our police officers, our fire department. I mean, we've had huge expenses, just like everybody else here, especially coronavirus. And, we're having to dig deep into our reserves. And I don't know next year what's going to happen, because we're pretty much going to be out of reserves by next year. And I know there's many cities out there that are out of reserves. So that's something else that I hope he'll look at. And it's a matter of, him signing or talking to other leadership there, but it's very important to the cities. But the window's closing, and that's why I want it to be here. That window is closing. It's closing fast. And if we sit there and not do anything, I don't want to be the one sitting here and talking about closing business again, or the hospitals are overcrowded like it almost happened, or it happened a few months ago. So I hope that the governor will listen. I'm open to talk to him. I'm open to visit him in Tallahassee, whatever it takes to make our point known.
Thank you. Thank you, Mayor Hernandez. Mayor Wagar.
Yeah, thank you, Mayor Gelber. I am pleased to be here with my colleagues this afternoon, and I absolutely concur with the 4 points that Mayor Gelber made earlier. And look, clearly we've seen an incline in infections, but we knew from the experts to expect those increases. And we're very encouraged about the Pfizer and the Moderna trials and outcomes. However, we need to get there first. And that's going to take some time. We've all gone through incredible hardships around this pandemic, both personally and professionally. We've watched our communities suffer, particularly on the business end. And those cities that are smaller like mine, we're working like dogs to try to hold up our business community as we're going forward in this pandemic. But we need solid mechanisms in place to manage the health and safety of our local communities, solid mechanisms. And for our communities as a whole, because we all cross-pollinate at some point. By way of example, we need access to state testing sites, and we need acknowledgement that masks are vital in providing protection against this virus. It's been proven. Masks should be mandatory. All we're simply doing is calling on the governor to use the power that all Florida residents gave him to help all Floridians and help us local governments stop or slow down the spread of this virus. Give us the tools that we need to get to the vaccine with the fewest amounts of deaths and hospital visits. Our hospitals are filling up daily, as Mayor Gelber alluded to earlier. So with that, we're simply calling on the governor to do what is hard, but most importantly, to do what's right. And I concur with my colleagues that are here today. Thank you.
Thank you. Mayor, make sure we unmute Mayor Ryan.
Thank you, Mayor. First off, I want to thank Mayor Gelber and Mayor Kriseman for pulling this together. As you see, we represent a cross-section. We're not just 5 mayors raising these points. This is the common discussion that's going on in our individual communities and our individual counties. There are a couple of very important points on how we've gotten here. In the middle of October, I, along with many mayors, met with our hospital systems. And they told us at that time they were preparing for a surge. I specifically asked them, is that because of something different about COVID? Is it something you're seeing? And they said, no. It is because we know that human behavior is going to change in light of the governor's order. Now, I'm not being political, and neither were they. They have ramped up on PPE. They're trying to deal with staffing, but they were preparing for this because it was entirely foreseeable where we would be today. I want to be very clear about this. We, in Sunrise, we're an economic powerhouse in the county. We have tens of thousands of jobs at the mall. We have so many people who come here. We are wrecked by the impact on the hospitality industry. And we were one of the cities, like a few of my colleagues, who had to close restaurants before the state did. And unless you're a mayor and you spend time and look in the eyes of your friends, of the people whose kids you've coached, and you tell them, I'm sorry, we need this sacrifice. You cannot know the pain of what it takes to close. We are all incredibly sensitive to this. But what's very clear is this is not a binary choice. It is not allowing it to rage wildly or shut the economy. None of us are suggesting that. This is our opportunity. The testing sites have been closed in our community that were state-run. Now, our Department of Health is trying to make up the gap. But our private partners in the healthcare industry are telling us they can't keep up. They are closing the walk-in clinics, and the lines are getting longer. And as Mayor Gelber said, you don't sit in line for 3 hours or 4 hours to get tested just because you got nothing better to do. It's because you're either have symptoms or you're terrified because somebody's home or you're really worried. I think, as has been said by my colleagues, the lack of enforcement, the suggestion that we should just rely on personal responsibility as our only tool is an incredibly horrible public health strategy. We need the enforcement. And I want to emphasize a point that I think has caused some of the complacency and maybe even some of the fatigue. What we have not been tracking institutionally, what the Department of Health statewide or even across the nation has not been tracking, is the long-term residual impacts of getting COVID even if you recover. We know that if you are put on a ventilator, you're going to have lung injuries and you're going to have long-term consequences. But what we're seeing, what's being reported in the medical literature, and we're seeing anecdotally, and we're seeing in our community, is that people who had mild or moderate symptoms, people who recovered, go on to have significant, debilitating, and concerningly, perhaps permanent injuries. Cardiovascular, neurologic, neuromuscular, mental health. These are real. And they're not just, it's not just a human cost. I mean, if you're cynical, let's think about the economic cost of this, the strain on our public health and our safety net systems going forward, the impact on our economy from the lack of productivity, people who could have been saved from the residual injury. I'll finish with this. It does sound hopeless, right? We have a positivity rate that is well above what we said we would tolerate before we reopened. It has been sustained. And now in the Tri-County area in Southeast Florida, we're in virtual parity. As my colleagues, Mayor Gelber and Mayor Hernandez recognized, there was a period of time when the positivity rate down there was much, much higher. Mayor Wagar, you understand that. It was much higher in Miami-Dade County than it was in Broward. We're in parity now. It is a full-on brush fire. The hospitals are getting a surge, and they're preparing. But we are presented with the most unique moment. We have the ability to reopen with outdoor capacity, to set seating distances, capacity issues, force masks, take advantage of the good weather we have to put off, as Mayor Wagar said, as long as possible before the vaccine comes. We don't even have that ability to encourage that and force that locally. If we do not act boldly now, we most certainly will look back on this moment and we will regret that we didn't stand up and ask for more. I will end with this. I spoke with our business community this morning, just like my colleagues do. They are terrified. They're terrified for their families. They're terrified for their employees, and they're doing what they can. But without the four things that Mayor Gelber has outlined and that my colleagues support, we are going to end up like the other parts of the country. If we act and it feels uncomfortable, then we acted at the right time. And as Mayor Garcetti said, if we act and it feels comfortable, it's too late. Yeah, our time to act is now.
Thank you, Mayor. We're going to take questions in a moment. Let me just say this. We're asking the governor to lead. We desperately need him to lead, not in the direction he's leading us now, which seems to be through some misguided approach that a few fringe scientists have said you should do. Even Sweden isn't following the Sweden example anymore. We need to quit this, and we need to start doing what mainstream doctors tell us we should be doing. We're trying desperately to do it. That's how we will navigate lives and livelihood. That's how we'll do it. We're not going to do it this way because he's not saving lives and he's not saving livelihoods right now. So let's take questions. Veronica, are you going to call on people and unmute them?
Yes, sir.
You've got, how do you want people to let you know? Amy has her hand raised, but you also have this function in Zoom that you can use. Okay.
MV,
Hi, yeah, this is
MV?
Martin Vassolo.
Go ahead, Martin.
Thank you. Mayor Gelber, is it the consensus among you and your colleagues that if the governor allows, cities should close back down bars and reduce capacity at restaurants and things like that?
Well, I think every place is different. And my city of Miami Beach has a population of 92,000 and receives 10 to 15 million visitors maybe a year. So obviously our approach, we're policing not just our residents and things like that, but more importantly, other people coming from other communities. I think that we have to abide by social distancing requirements. The governor didn't just open things up. He flung the door open and said there's no rules anymore. I think he'll allow stadiums to have whatever they want, and they won't do it because the sports teams themselves know better. He opened up not simply bars, but said, don't worry about social distancing. What he's doing is following herd immunity. So for me, we should be exercising social distancing as the CDC says we should. It's that simple. I don't have anything other to say that we should follow the science and the medicine. And our governor isn't right now. In fact, I think he's purposely not. I don't think I'm accusing him of doing something. I think he would agree with me that he thinks that these fellows who championed this Barrington doctrine of letting it flow, letting it rip into the community, or Dr. Atlas, who said the same thing. Those are the people he met with, not Dr. Fauci. Mayor of Miami meets with Dr. Fauci, but the governor of Florida doesn't. Okay, there's something wrong there. So we will exercise social distancing, and however that comes into a specific establishment will just have to be followed.
Amy, go ahead and identify yourself and the station.
Hello, everybody. JB Biunno here, WFLA in Tampa. Question here for Mayor Kriseman over here in St. Pete. Mayor Kriseman, what exactly are you calling on Governor DeSantis to do here? Do you support statewide action? Do you support scaling back to phases 2, phase 1? Do you support shutting down certain businesses such as bars, restaurants, or do you think the governor should take a region-based approach here and just do it based on particular regions of the state?
So look, we in Pinellas County and in St. Petersburg, we have an emergency order that requires businesses and the people that work in those businesses to wear masks and to require the patrons of those businesses to wear masks. But the problem is when you have the person who is the head of the state that is not indicating that he believes that mask usage makes a difference, then when he doesn't have an order that is universal, because, we can have a great order here in St. Pete, but, that doesn't mean that people who don't live in St. Pete and come visit us may have the same order. And so when it comes to mask wearing, that one's an easy one. Yeah, the entire state should have a mask order. When it comes to occupancy requirements or whether it's 25% or 50% or none, that's community to community. But we like to have the flexibility of that. Social distancing is another one of those. That should be an easy one. The governor should say, whatever business you have to enforce social distancing rules. That is mandated. But that's not what we're getting. And that makes a difference. It makes our jobs as mayors so much harder when the person who is at the top of the state, the leader for the state of Florida, isn't on the same page as us. And quite frankly, as has been said by my colleagues, hasn't bothered to call us and even talk to us about what's happening in our communities and what they can do to help us.
Thank you. Go ahead, Amy.
Got to unmute her. There you go.
We don't hear you. You're unmuted, Amy. Nope, we still don't hear you.
Maybe test your mic and we can come back.
We'll come back to you, Amy. Don't worry.
Veronica, you got a bunch of people in chat. Why don't you just call on them?
Can you hear me, Veronica?
Yes. Can I ask my question? I wanted to ask you all if there's a date by which you'd like to receive some kind of response from the mayor's office, because today he sent out an email about snapper fish, and I'm just wondering if there's a way to communicate like how soon you'd like some kind of response, and if the next step would be to go through the county mayors, maybe like what happens next.
Who is that to? Veronica, let her say who that was to. Well, if the question was, what do we want a response by? I can tell you that every day I look at the data. I know every one of these mayors looks at the data every single day. I think yesterday, 18 people or 19 people died in my county. So every day we don't do something, and 2 weeks later, it's math. Every 100 people that check into the hospital, about 10 or 15 are going to die. And a couple multiples of that will be hospitalized, as Mayor Ryan says, with potentially lifelong conditions. So we can't wait any more days. You hit a tipping point on this thing the moment you get a lot of infections, because as life follows day, that you're going to get a huge number of hospitalizations and resulting deaths almost mathematically. Now, at the beginning, it was more people were dying because our treatments weren't as good, but they're still dying at a click of 10 to 15 for every 100. So we had 72 people hospitalized yesterday. So about 8 of them will pass away. We can't wait anymore. This has become, sort of absurd and to the extreme, where governor insists on this theory of herd immunity that is going to do nothing but spread the disease and kill people. It's just got to stop.
And if I can, Mr. Mayor Gelber, add one issue.
And then Mayor Hernandez, go ahead, Mayor.
All of my colleagues are terrified of what's coming. We are in the middle of flu season. We have the Thanksgiving holiday, which is bringing college students back from hotspots all over the country. We are a desirable place to go. People want to leave these hotspots that are cold, that have no indoor dining, that have everything, and they want to come here, and they are going to come here. You add on top of that we then have the December holidays and we have New Year's. We know what's coming here, and that's why urgency is today. Because this weekend and next weekend, we are going to be facing a crush, particularly in places, and I'll along the Eastern Seaboard. These are hot spots where people are going to congregate and they're going to come out. And if we don't have the capacity to set enforceable mechanisms, including, social distance, physical distancing, and masking for businesses, we are absolutely going to see in December a horrific count.
Mayor Hernandez?
Yeah, I don't, every day counts. Because again, I am terrified, and the governor is gambling on this going away or something, but every day counts. And we're gambling on lives and our businesses. Again, everybody talks about maintaining those businesses, and the best way to maintain those businesses open, or as open as possible, is by us taking care, again, not taking care of each other, because that's important, but those people that don't want to follow regulations, we have to impose some things on them. Citation was a big issue in our city, and it worked. Going to businesses, especially restaurants, and making sure that they were following all the guidelines was huge. And again, right now it's like a free for all, and hoping that it's taken away. So he's gambling on people's lives and on the industry, the jobs of the state. I hope he's right and I'm wrong, but science is not saying that.
Okay, Veronica, you're going to call on someone from the chat. We've got a bunch of questions.
Hey guys, can you hear me? I'm just going to jump in here.
Yeah.
Carlos, 6. Some of these items that are being asked of the governor have been asked of him since the beginning of this pandemic, and he hasn't acted on any of them. So I'm curious, if the calculus hasn't changed, what avenues do you have left? Is a curfew the only thing that you might be able to use, considering the county's curfew was upheld by the court? And then my only other question to that is, what threshold are you comfortable saying we need to shut things down? And the mayor up in Broward yesterday said he expects things to be north of 10% in terms of new cases. And so I'm wondering, moving forward, what is it that you think you can get accomplished considering he hasn't acted on any of these things before?
Well, first of all, across the country, governors are changing their minds. I think the hallmark of a good leader is to be informed by conditions and not be afraid to, change your mind about something. I don't think, and by the way, I know Mayor Suarez is talking to the governor and showing him data points about how in our city, in our county, the moment we put the mask mandate in place, there was a substantial reduction in the virus. So, maybe this is all new to all of us, and nobody wants to, I don't think pointing fingers is always the first thing you should do. But he's the governor, and I think he will reconsider the mask mandate. He certainly should reconsider letting us, which he was doing before, by the way, Alex. He was letting us enforce mask usage. We were the first city in Florida to do it because we get so many visitors. We realized how important it was at that point to do it. I know my colleague out west, Mayor Hernandez, and others were doing the same thing when they realized it was important to do. So I think he's going to consider all of these. He did have a lot of testing going on, and now he's not. Maybe he shouldn't go back to that. He needs to, because people shouldn't have to feel like getting a test is going to be that much trouble, because it's healthier for them to be tested so that if they have the disease, that other people will know it. And in terms of the contact tracing, we have done better. When we started in the first surge, the number of people who were even being reached was about 17%. Now it's about 45%. So we've got more staff and we are doing better, but he needs to use the app. He needs to make it available either for the state or for counties. Because, there's an article in the Washington Post today showing that a lot of places that thing has become very effective. In fact, I think the governor of a state learned he had it and from the app itself. So, we need to use everything. This thing isn't over because the vaccine's on the horizon. In fact, I fear that the worst may still be in front of us, and that's why we need to do this. I think the governor will reconsider favorably some of these ideas. He ought to do all of them because he's a smart guy. He should see that the course he's taking is failing miserably right now, miserably.
I'll jump in here, guys. This is Josh Solomon from the Tampa Bay Times. Hello, mayors. Mayor Kriseman, back in March, you and others in the Tampa Bay area were consistently applying pressure to the governor to take statewide action, including, of course, implementing safer home orders locally before he did statewide. Is this coalition about reapplying that pressure?
I think so. I mean, as Mayor Gelber was just saying, our hope is that he pays attention to the mayors. We are the closest to the people. We have to deal with what is happening on the ground each and every day in our communities. And so our hope is that he'll listen to us, that he'll see what is being done in states all around the country and not just blue states, and that he will be willing to change his mind and recognize that it isn't working here in Florida. Look, we always talk about wanting to be number one. This is not something we want to be number one in. We don't want to be number one in the most cases. We don't want to be number one in the most deaths. If anything, we should want to be at the bottom of those lists. And that's what we ought to be striving for. But it only works if we're all doing it together and we're all working on the same page to the extent we can. And that we as mayors have the flexibility to tailor what works best in our communities without being handcuffed from doing that.
Thank you.
Okay.
Hi, this is Tamara Lush from the Associated Press. I have two questions. One is, how worried are the mayors about the spread over the Thanksgiving holiday? And second is, how confident are you in the numbers given to you by the state in terms regarding the COVID infections?
Well, I want to, somebody else talk about Thanksgiving. I think we're all worried about it. Mayor Wagar, you must be worried about Thanksgiving.
we're all very, very worried about the holidays. I mean, look, no matter where we are down here in South Florida or in Tampa, people are coming. And I have constituents whose families and children are coming back from college, and they're not just going to come to Miami Shores to be with their parents and their grandparents. They're going to want to move around Miami-Dade County, perhaps go to the beach or go over to Hialeah for a bite to eat. It's not just going to be central to my municipality. So I think, we're going to be worried about that. Then we have Christmas coming up. And then again, we have New Year's, which is what one of my colleagues mentioned. But I want to speak to something about our businesses because it keeps coming up. And we're talking about saving the economics of our municipalities. In my city, we have lost 4 businesses alone because they couldn't keep their doors open because of the fluctuating rules. Is it that we're going to have social distancing? Are we going to open up? Are we not going to open up at all? There's no consistency. And without that consistency, the businesses located in my municipality couldn't survive. And we're fighting to keep the remaining businesses open with the little bit of resources we have and the little bit of guidance we've been given. So I think all we're looking for is some collective guidance so that we can get ahead of this rather than behind it like we are currently.
I'll answer the question about the numbers. Look, obviously, we get information from the Department of Health, and I probably as much as anyone, I am on the phone with them every morning asking questions. I asked, for instance, whenever we see a lot of positives, was it a data dump or was it just, or should we smooth it out? So look, we hope the numbers are right. We hope, obviously, they're trying to get it right, because if they were trying to get it wrong, that would be horrible. Can't imagine they're trying to get it wrong because the numbers are really showing a very grim picture right now. I don't think we need to see worse numbers to know that we're already close to off a cliff in this state right now. And as Mayor Wagar just pointed out, when you add on where we are now, because where we are now has not been felt yet. This last week has not manifest yet in hospitalizations and deaths. That's weeks away. So where we are now is where we were 2 or 3 weeks ago when it was an uptick. Now it's a surge. Imagine what is going to happen when you take that uptick, you put on it a surge, and then you add on all the holidays. That is going to be something that is frightening, more than we've seen. And really, we're trying to ring a bell right now. And we're not, this isn't to give the governor a hard time about just something political. It's about saying, look, we are very close to this. We see this. We know people who have gone to the hospital. We know families who have lost loved ones. It's going to get much worse unless you change direction. And we are telling him that. I know mainstream physicians are telling him that. I suspect his own Department of Health is telling him that. He needs to accept that and he needs to do it. And by the way, I'll be the first one to say he's doing a great job if he does that.
Hey, Gelber, let me just add on the numbers, and it's something my colleagues do. We try to triangulate the data that we get. When we see a high positivity rate, we look, are we also seeing it in the hospital systems? What are they showing? And what we're seeing is early stage hospitalizations. The COVID positive rate is well over 13 or 14%, much higher than what's in the community, which to Mayor Gelber's point, that reflects a lag indicator from what we have seen. Emergency department visits with influenza-like symptoms have gone up 30 to 40% in the last week. So it is important to look at a singular number, but it's more important to look at what we see in the trends and to be able to triangulate and build in what hospital systems are seeing as well.
Hi there, Angelina Salcido here from 10 Tampa Bay in Tampa. I just wanted to ask all of you guys, if the governor doesn't respond to what you guys are saying today, how will you feel about that? And what message do you feel that sends to Floridians?
I'll answer that first. You know what? Again, I think from the beginning, and I think Dan just said it, I don't care. We've all made mistakes. I'm sure he's made mistakes, but you know what? If you can correct them now, God bless you. We're with you 100%. I think that if he doesn't respond to us, I think, first of all, it's very unprofessional. I think it's disrespectful because, again, every mayor here is a representative of their community. And so I think that would be disrespectful. First of all, I hope that doesn't happen. I hope that at least he gives us a reason of why he wouldn't do some of these things. But at the end of the day, time is going to prove him wrong or right. And right now, if you look at the numbers and the scientific facts, he's going to look pretty bad a couple months down the line. And nobody wants to look bad. Again, we want to work with him. And I think it's another alert call that we're saying, Mr. Governor, we're here with you. We're seeing these problems in our communities. Let's work together and find solutions before it gets to a point where it's going to be dark, health-wise, and for our businesses.
That's how I feel.
Mayor Hernandez, did you want to give also that same soundbite in Spanish?
Yeah, if anybody wants to Spanish, I'm waiting for any Spanish questions here, and I've heard everybody, so I think I can. But aquí lo importante es mandar el mensaje al gobernador DeSantis que estamos preparados para trabajar junto con él, pero de nuevo el camino que estamos viendo en nuestras ciudades, en las decisiones que se están tomando, estamos viendo los números subiendo constantemente y sabemos que si miramos la trayectoria y lo que está diciendo la ciencia, nos vamos a encontrar un problema bien serio si él no toma algunos cambios en las próximas semanas o los próximos meses. De nuevo, las ciudades queremos trabajar con él y la cosa de las máscaras y la distancia social es algo básico para proteger nuestra salud y al mismo tiempo nuestros negocios que no tengan que cerrar de nuevo.
Gracias.
Thank you.
Let me just say that, and I want to say, really reiterate what Mayor Gelber said. We're hopeful the governor will listen to us. He's an incredibly smart man. And I will tell you that in April, I had a conversation with him. He wanted to know why we closed our restaurants ahead of the state order and why we only went to takeout. We had a very frank discussion about the challenges we face locally as mayors. And he reversed course and he went and he did what was the right thing. I just asked him to go back to April and that type of dialogue that we have as mayors with him. And this is the time for him to reconsider, extend 244.
By the way, I had the exact same experience. Early on, spring break looked like it was a terrible, I called him up, sent him pictures of what was going on. He was incredibly concerned. And, you know, and I frankly publicly said I was happy he was so available. I think something's happened since then where he's decided to avail himself of some very bad advice. Maybe it was political before this election because I think the Trump administration was trying to give an appearance that everything was going fine, but it didn't really matter what the purpose of it was. The people he's listening to, they are fringe scientists. They're not mainstream scientists. And you can't set public policy, healthcare policy on fringe theories. You just can't do that because it's not like you're in a class. You're in life, and that means if you're wrong, people die and get sick. And we're seeing people die and get sick. So he has to reverse course because it's got to be obvious to him that this approach is the wrong approach. All right, let's take one more question. Can I say that, Veronica? You're muted. Press.
Hey, I just had two more questions. One for Mayor Ryan. Mayor, do you think your municipality is past the threshold where if you could, you would restrict capacity at restaurants and bars and businesses like that? And then to Mayor Gelber, because you're in communication with Director Moskowitz, what is the deal with the state-run sites? Are they not fully funded right now? Thank you.
Mayor Gelber, you want to go first or you want me to go?
Sure, I'll quickly tell you. So the state has rolled back a lot of its testing. And in fact, in Dade County, I think most of the drive-up tests are no longer state supported. The one here, they got rid of the state support. So now the county is supporting it. Don't know how long they'll do it for. So, you know, that's obviously happening in other places. Dade County has got the most infections of anyone, but they're everywhere. And so I think this is happening across the state. And by the way, rolling back testing and not testing is exactly what those advisors I was just referring to told the governor to do. They said, you shouldn't test people. It's not that helpful. And that you don't need to wear masks. And that's why the next day he stopped my city from enforcing an individual mask mandate, as he stopped every other city who wanted to do it. So testing is being limited right now, and it should be going in the opposite direction, as where it should be more expensive, especially since there's cheaper and better tests available that should be used.
I would reiterate that we have the same experience in Broward County. The state sites have been curtailed significantly. And I would just look to Dr. Fauci, who today said he regrets that he didn't push harder to make sure there was more testing, because testing and isolation is the key to getting ahead of this. With respect to the question about any single municipality, this is an incredibly important question. No single municipality can take action. We needed to do it by the county. When we first started this, city by city were doing different things. And that patchwork of public health policy is an absolute failure. It's not only counterproductive, it's unfair to ask certain businesses to close, and then right across the street, and literally in my city, the day we closed restaurants, I drove around. We had great compliance. It was hard. There were tears. But in my neighboring municipalities, I could see packed to the gills restaurants. So not only is it not fair, it's counterproductive. So what we really need, and this is what the mayors have been asking for, is this really regional county approach. We know what's going to work here. Listen, there may be areas of the state where they don't need to do this. We know what we're facing. We're talking to the hospital, we're talking to each other, and we want to work in unison, because it will do no good if Miami-Dade County takes action and Broward does nothing. We have seen that time and again, where one set of beaches got closed and everybody went to the other one. So to your question, no single city should take that burden, should force that level of sacrifice. We need Executive Order 244 extended and modified, and we will handle this county by county, and we will go back to the collaboration that existed in April until September 25th.
And let's get the, thank you, Mayor. Let's get the final question from Telemundo. I understand they had a question.
Yeah, this question is in Spanish for Mayor
Yes.
Hernandez. Alcalde, díganos cómo pretenden ustedes hacerle llegar al gobernador todas estas propuestas que han discutido aquí para que él tome acción. O sea, porque él no está presente en esta reunión. ¿Cómo se enterará de lo que han hablado aquí?
Estoy seguro que esto se mandará. Esto tendrá una copia de esto para él escuchar, pero de nuevo lo importante, y él tendrá esta información, es que los alcaldes queremos trabajar. Estamos viendo que la dirección que está tomando el coronavirus, estamos mirando cosas peligrosas en este momento, y la manera que va hacia adelante en este momento, no estamos de acuerdo, y lo que queremos decir, oye, vamos a trabajar juntos, gobernador, con nosotros, porque nosotros conocemos, de nuevo, cada condado es distinto, las ciudades son distintas, el estado no puedes tratarlo como si fuera un estado total, y de nuevo, las cosas más fundamentales, como el uso de máscaras y la distancia social, él quitó y le quitó la fuerza a los condados y a las ciudades de poder usar eso. Y de nuevo, para mí, para nosotros, son de las cosas más básicas, fundamentales, para poder proteger nuestra salud y nuestros negocios, porque él abre los negocios y nuestros negocios.
With that, thank you. I'm sending a letter to the governor today with these items on it, so I think that's already available. I want to thank all my colleagues. You know, I can't stress to the people who don't know this, we call each other all the time. We talk about this all the time. We look at the same data. We compare notes. We talk about what's happening. We all of us sort of understand, because it's our jobs to talk to people and be there, what's going on. We are really just asking for help from the governor right now. We just want him to lead in the right direction. That's all. I hope he receives this in the best of intentions, because it comes from only a point where we're crying out for help. So, all right, thank you all. Thank you to my colleagues. Thank you all.
Thank you, Dan. Thank you, guys.
Thank you. Thank you, Dan. See you guys. See you, Mayor Wagar.